I'm Candy Thurman, and this is Jessica Vasquez, and she's agreed to let me do an assessment onto her today. Is that okay?
Yes, ma'am.
Good. First of all, we're going to start off by getting your height and your weight, okay? Let's see how, have you turn around, I'll see how tall you are. Okay, go ahead and step down. It's like 5'5½". Okay. Wash my hands here. I'm going to take your vital signs. Is that okay? Okay. Start off by taking your blood pressure. (119/68). Okay, now I'm going to palpate your radial pulse here on your wrist for 1 full minute. Okay, it's 82. Also checked your respirations while they were doing that. Now I'm going to check your temperature. Put that in here. There we go. Okay, it's 98.2. Now I'm going to start off just by inspecting your skin. I'm just going to look at it, okay? Look for any lesions, masses, any hypo or hyperpigmentation, discolorations. Gonna look all over, look on under your arms. Any edema to your feet at all?
No.
No. Good. Okay, I'm gonna assess the temperature of your skin. It's warm, texture smooth, your skin's thick. I'm gonna go ahead and look at your nails. I'm gonna look at the contour. The profile, no clubbing at all. Okay, I'm going to check your capillary refill. It's instant return. I'm going to go ahead and lean down here and check it on your feet too, okay?
Okay.
That's also good. Now, I'm going to go ahead and check some skin turgor here. Just going to pinch this skin up and it should go back down right away. Very good. Okay, now I'm just going to inspect your scalp. I'm just going to look at your hair. Evenly distributed. I don't see any thinning spots or any masses or lesions at all. Now I'm going to go ahead and palpate your scalp. I'm just going to check. Feels symmetric and smooth, normocephalic. Any tenderness at all?
No.
Okay. All right, now I'm going to go ahead and just feel for your temporal pulses here. Here above your ear. Good. Those are palpable. Now what I'm doing, I'm apply a little pressure to your temporomandibular joint here, your jawbone. Okay, go ahead and open. Good. It's smooth, no crepitus. Any tenderness when I palpate there?
No.
Okay. Now I'm just going to look at your face. Look at your eyebrows, your eyelashes, nose. It's all symmetric. Lips are symmetric. Now I'm going to go ahead and palpate your sinuses. These are your frontal sinuses. Do you have any tenderness there?
No.
Okay. Is your maxillary? How about here?
No.
None at all?
No.
Good. Okay, now we're going to check your eyesight. I'm going to go ahead and have you stand up here, and I've placed a Snellen chart 20 feet from here. I want you to cover one of your eyes, whichever one you want, and read the smallest line that you can read.
D-E-F-P-O-T-E-C.
Okay, good. That's 20/20. Go ahead and repeat with the other eye.
D-E-F-P-O-T-E-C.
Good. Very good. Now I'm just going to look at your eyes. I'm going to pull them down here and look at your conjunctiva. It's pink, no drainage. Eyeballs are glossy, sclera is white. Good. Now I'm going to go ahead and check your visual field by confrontation, okay? So what I'm going to do is I'm going to put my hands behind you and I'm going to start moving. I'm going to bring them forward and I need you to tell me when you see them, okay?
Now.
Good. I'm going to do the other side.
Now.
Good. Now I'm going to check the muscles around your eyes in the 6 cardinal positions, okay? I just need you to look at my finger and follow my finger with only your eyes, okay?
Okay.
Good. Okay, now we're going to do what's called the cover test. I'm going to check for muscle weakness. I need you to cover one eye, whichever one you would like, and just stare right at my nose with that eye. Okay, go ahead and uncover it. I'm just looking for it to stay steady. Go ahead and switch with the other eye. And remove the card. Good, no weakness there. Put that card down. Now what I'm going to do is I'm going to take this light here and I'm just going to check for a corneal light reflex. And that means the light reflection is on the same, both sides, okay? It's on. Go ahead and look at me. The light. Very good. Very good. Now, while we're doing this, we go ahead and just check for pupillary reaction. You just look straight ahead. I'm going to make sure that your pupils constrict. Good. Good. Now I'm going to do it one more time, and I'm going to look at the opposite pupil for the consensual light reflex. Good. And good. Okay, last test we're going to do is for accommodation. Okay. What I'm going to have you do is go ahead and turn sideways. I'm going to place my finger about 3 inches from your face. Go ahead and focus on my finger and then find something over there in that corner, distant, to focus on. Okay, that dilated your pupils. Now I need you to look back at my finger and constricted them one more time. And back at my finger. Very good. Okay. Your pupils are equal to round and reacted to light and accommodation, okay? Now what I'm going to do is I'm going to inspect your ears and just going to look at them. Look for color. They seem to match your complexion. Don't see any lesions or masses at all. I'm going to palpate them and feel for any nodules. Any tenderness there at all?
No.
Good. Okay, now what I'm going to do is I'm going to go ahead and do an otoscopic exam, okay? I'm going to look at your ear canal for any redness or swelling or drainage. Good. I'm also making sure the tympanic membrane is the right color, pearly gray. It's flat and translucent, doesn't have any bulging around it. Good. Okay. Now what I'm going to do is I'm going to test your hearing, okay? I'm going to have you take one hand and just use your tragus there and close that. And I'm going to whisper just a word, and I need you to repeat it for me, okay?
Okay.
Good. And let's repeat with the other ear.
Okay. Go.
Good job. Now next, I'm just going to look at your nose. Look for symmetry. It's symmetric. Same on both sides. The septum here in the middle is straight. Okay, now I'm just going to palpate it. Any tenderness at all?
No.
You don't see any lesions or anything like that, no deformities. Okay, now we're gonna check the patency of your nose holes. So just plug one side and go ahead and suck air through the other one. Good, and let's do it on the other side. Good, okay. Now what I'm gonna do is I'm gonna go ahead and put on a pair of gloves and we're gonna check your mouth, okay? Okay, first I'm just gonna look at your lips. They look, I don't see any cracking. They look moist. I'm gonna pull that and look on the inside. It's moist, no lesions at all there. Okay, I'm gonna open your mouth, inspect your teeth there. Okay, go ahead and bite down. Good, jaws aligned. Okay, I'm gonna go ahead and grab this tongue blade here and open up. I'm gonna look for any diseased teeth at all. Use this side here. Good. Any tenderness or anything like that? Okay, good. No nodules there. Now what I'm going to have you do is go ahead and, let me see the upper gums. Okay, no lesions there. Now I want you to stick out your tongue. Good. And flip, let me see the bottom of it. Good. And while you've got that up, I'm going to go ahead and check this U shape here. Make sure no tenderness or any nodules down there at all. Okay, good. Let me make sure I got the inside of your mouth. I'm going to check your palate. Good. Okay, I'm going to go ahead and have you say ah. Good. U to this midline. It looks like, have you had your tonsils removed, Jessica?
Mm-hmm.
Yeah,
Yes.
looks like you have. Okay. Now, I actually would have checked your gag reflex at that time too, but we're not going to do that, okay? Now I'm just going to inspect your neck. I'm going to look for any discoloration, any nodules or lesions or anything like that, okay? First of all, I'm going to check your range of motion. If you would, turn your head to one side. Okay, and back to the other side. Good. And try to touch your chin to your chest. Good. And can you tilt your head back? Good. And now try to touch your ear to your shoulder without moving your shoulder. Good. Okay, now I'm going to test the muscles. I'm going to place my hand here, and I want you to try to turn your head against my hand. Good. Good. Okay. And go ahead and remove my gloves here so I can palpate your neck. Okay. First, we're going to start off, we're going to palpate your lymph nodes, okay? We're going to start here at your preauricular region. I'm going to use a circular motion. Normally, we wouldn't feel any lymph nodes at all. Okay, then we're going to go posterior auricular. Okay, and occipital. So any tenderness there at all?
No.
Okay, then we go submental. This is right under your chin. Is that sore at all?
No.
Okay, and how about submandibular? Is that sore at all there?
No.
Just using a circular motion there. Okay, and the next one is right here in the very front, right here. It's called jugulodigastric. You can actually feel the one on the right. Is that sore at all?
No.
It's freely movable, non-tender. Good. And then we're going to go to superficial cervical right back here. Feel anything there? No pain at all?
No.
Okay, and then we're going to do the deep cervical chain. I'm going to just do it with one hand. I'm going to push this muscle to the side. Okay, I'm going to do it with this other. I'm just going to steady it right there. Okay, I'm going to go to posterior cervical right here. Any tenderness there?
No.
Okay, I'm gonna do supraclavicular. If you would just kind of roll your shoulders forward. There we go. No tenderness at all?
No.
Okay, next what I'm gonna do is I'm gonna check your trachea. I'm just gonna put my index finger here in this notch and slide it off to both sides. Symmetrical, no tenderness or anything at all right there.
No.
It's symmetric in midline. It looks like we're done. That completes the head, face, and neck. Thank you.